I felt nothing. I have 0 risk factors. I was diagnosed on routine annual mammography. My name is Barbara. I was diagnosed and am being treated for early stage breast cancer at Monmouth Medical Center. So it was scary, but the pathology results indicated that it was the type of cancer that was very manageable and treatable.
So Barbara was very lucky. She had a routine screening mammogram, which is something that every woman should have after 40 every year. The first mammogram showed asymmetry in the breast, that is, there was something that did not look right. So she had a biopsy, which showed that it was the most common type of breast cancer that we see, which is estrogen receptor related. So it was estrogen receptor positive.
I think perhaps the fact that I'm a former oncology nurse and a former oncology case manager gave me insight that the data that was being collected on my case was very, very favorable. Based on the pathology report, I was, of course, referred to a breast surgeon, and she recommended a lumpectomy, followed by radiation 6 or 7 weeks post-lumpectomy.
Since it was a very tiny spot, she could still save her breast and had a very small surgery, which is a lumpectomy with a sentinel node biopsy, which means that we sample one of the lymph nodes that is draining the cancer to make sure that the cancer has not spread out of the breast.
The surgery went very uneventfully. I was fortunate I have no side effects from the anesthesia. I have very little pain.
Because she had a lumpectomy, she had radiation, which is a modality to eliminate any cancer cells that might still be there in the breast.
The prognosis with the radiation is in the high 90s of no recurrence, so I went for it.
Breast cancer is very common. 1 in 8 women are going to have breast cancer in their lifetime. The prognosis is excellent if you catch it early. So she really benefited from her screening mammogram.
All of the professionals with whom I had dealt from the beginning have the perfect balance of professional expertise, technical know-how, and compassion. And one really is as important as the other when you're handed a diagnosis of cancer. So I really can't say enough about the doctors, Dr. Coley, Dr. Sim in radiation, Dr. Magel, my medical oncologist, and their staffs. Their staffs are marvelous, really marvelous. And they work together as a very close team. The entire breast center, I can't give them enough accolades. I'm feeling very lucky that the cancer was found so early by the excellent radiology team at Monmouth Medical, and I'm feeling blessed that I have such a wonderful group of providers taking care of me.